Hello, I'm Dr. Jamie Tungate, and today we're going to be talking about neuropathy and how you can get lasting relief from your pain, numbness, burning, cramping, all without any drugs or surgery, so you can enjoy life again. So how would you like it if you could feel 60 to 100% improvement in your symptoms? Well, that's what we're going to talk about today. So I want to congratulate you on taking the first step. So in joining us on the workshop today. So that's an important part of getting your life back. You want to stay till the end because you're going to learn a lot of important information. You don't want to miss anything about treating your neuropathy, and I have a special offer for you if you stay till the very end and you get started on your road to recovery there. So I'm Dr. Tungate. I've been treating patients for years in my office. I have a bachelor degree in chemistry from Michigan State University, and I'm a doctor of chiropractic from Palmer Chiropractic College. So I've been creating health for people that want to change their life. So this is me. I have my physical office in Tempe, Arizona, suburb of Phoenix. As you can see, we've got over 213 five-star reviews on Google there. So you want to make sure that you're always keeping an open mind because a lot of this information is going to be different than what you know about neuropathy already or what you've been told by your medical doctors. So suffering. What I've learned since becoming a doctor is that many people suffer in pain, discomfort, limiting problems from different symptoms of not being at optimal health. They do this because they don't know that there is an option for them to get better. I've had patients tell me many times that they are a different person after they started treatment with me. Some said they were ready for a nursing home. Some say they were out of pain for the first time in years, and others just said that they didn't know they could feel this good. So how can you get relief from your neuropathy? Are you experiencing numbness, burning, experiencing those in your hands or your feet, any low back pain, any other joint pain? The lecture today, you'll understand the challenging truth for the standard of treatment, what could be causing your pain, the documented dangers of neuropathy, proven methods for creating lasting relief, simple steps you can take to get on the road to feeling great again. Are you tired of taking medications that don't fix the problem? They only cover up your symptoms and make you feel worse. We average 18 new prescriptions per year in America. So Time Magazine ran an article said they're the most powerful painkillers ever invented, and they're creating a world of addiction. So that's the disturbing truth in American healthcare right now. So we're seeing concerning increases. There's a 1,200% increase in the number of diabetes, which is the number one reason for neuropathy. So 1,200% increase from 1958 to 2000. So there's also heart disease and neuropathy. So those are all linked together there. And, neuropathy can happen for over 100 different reasons. Diabetes is just the most common of those. Over 30% of the cases of neuropathy are for diabetes. So how much do we spend on healthcare in the US? $3.2 trillion on healthcare. That's insane. So more than double any other country spends per person on healthcare. The US consumes 75% of the medications produced in the world, and we're only 5% of the population. So what's interesting is that we have the most doctors, the most hospitals, and the most money, the key question here is, where do we rank in the world? Well, there's 27 industrialized nations in the world. There's 200, a little over 200 countries in the world, 228, some I think. And so we rank 69th in the world. So out of 27 countries, we're dead last. And that means that there's an additional 42 countries that aren't even industrialized nations that beat us in healthcare. And that's by the Leg-Tum Prosperity Health Index score. What's causing this? Well, your average home has two washing machines, one for your clothes and one for your brain. So it's called social conditioning, and it's been a direct effect on us as human beings. We are being highly persuaded. Advertising for pharmaceuticals is $6.88 billion, and that's from a few years ago, so it's probably up from that now. The most common culprit, well, you can imagine the big money makers. So Neurontin is one of the major ones. So that's an anti-seizure medication. It slows down your brain so that you don't feel your feet and does not stop the progression of the neuropathy. Then there's Lyrica, which is also a anti-seizure medication and slows down your brain so you don't feel your feet. It does not stop the progression. So a lot of us are treating ourselves worse than we're treating our car. So what would you do if you saw this, a check engine light? Well, you'd probably go and see a professional and get it diagnosed to find out what's wrong with it, unless you happen to be a mechanic yourself. So if you were having some of the issues we mentioned earlier, burning feet, not being able to sleep in the middle of the night because of your pain. So what is peripheral neuropathy? Peripheral neuropathy is damage or disease affecting the nerves. It can be associated to feet, legs, arms, hands, back. So it's quickly becoming one of the most common chronic diseases in the US. 8% of the US population, or about 24 million people, suffer from peripheral neuropathy. Peripheral neuropathy can occur at any age, but is most common among older adults. 30% of the diagnoses are linked to diabetes. So what are the most common signs of peripheral neuropathy? So we've got numbness, burning, cramping, sharp electrical pain, prickling, tingling, balance problems and falls, and you can't sleep from the foot pain. It's like a household cord. So if you had a cord that was frayed, your power cord to the toaster, so it's not going to work right. So you could cause burnt toast, could cause the toast not to cook, could catch fire. So it's going to work intermittently. So the top causes of neuropathy are diabetes, pre-diabetes, poor circulation, toxic exposure, neck, herniated disc, spinal stenosis, post-surgical autoimmune diseases, infections, alcohol abuse, liver or kidney disease, thyroid conditions, and another common one there is medications. So including chemotherapy, it's a big one. So these are the different types of nerve fibers you have. The big ones are going to be controlling the muscles, and then the smaller ones are going to be your minor feeling or sensitive touch, like sharp pain, light touch, temperature. So touch and the pressure fibers are in the middle there. So different nerve fibers for different things. So neuropathy leads to a lot of falls. So that's why seniors have so many falls, is because a lot of them have neuropathy. And so that causes balance problems because when your feet can't feel properly and they're numb, then they're going to have an ability for your body to be able to have good balance because you're not getting good communication between the brain and the body. So 1 out of 3 adults over the age of 65 falls every year. 20 to 30% of those suffer from moderate to severe injuries. 10% of those falls are fatal. So it's a leading cause of death for people over the age of 65. So and those would be more of the large fibers that cause those falls when those are not, so it's the A alpha. And so the other fibers there are going to be more for the sensory, and neuropathy also unfortunately leads to amputation. So every year in the US, there are about 86,000 diabetic or neuropathy related amputations, one of the most feared complications of the disease. Patients may be struck with a sense of hopelessness, the prospect of losing a limb and mobility. And numbness can not only affect you, but it affects others as well. So you can lose your freedom because you can't drive anymore, and you can't drive anymore because you can't feel the pedals correctly. So unfortunately, people have accidents because they can't tell where the pedal is, and sometimes they hit the gas instead of the brake. This is a picture here of someone driving through the front window of a restaurant. We almost had that in the restaurant I worked at when I was in high school. Someone ran into the building for the same reason. It was a brick building though, so luckily they bounced off and no one got hurt. But I've seen it in person happen right at the office. So what are your choices? Well, you can either do nothing, you can go to your primary doctor and get some drugs to mask the symptoms. You can get referred to a neurologist. What does the typical neurologist do? They do nerve testing, more medications, and they tell you nothing can be done. You have to live with it. Well, we know that's not true, because just living with it can lead to losing toes, using walker, using a cane, being in a wheelchair, or having an amputation. Doing the same thing over and over again, then expecting different results. Well, Albert Einstein said that. So it's the definition of insanity. But there's good news. The National Institute of Health says peripheral nerves have the ability to regenerate as long as the underlying nerve cell has not been killed. So the top one there is a healthy nerve. And then as you progress down, that's as the nerves are dying and getting worse and worse. So obviously you should take action as soon as possible, as soon as there's any nerve damage. So the 4 key steps to feeling better: rejuvenate by increasing your blood flow, stimulating the nerves, activating through therapy, empower by decreasing inflammation. So we've had lots of testimonials here. So they were intense pains, only sleeping 2 to 3 hours per night. And then after the treatment, they're able to sleep through the night. Again, another person that stopped sleeping, they're now at a level 0. Before they were at 11. And just another one here. Again, they're talking about the red light therapy and how it can improve your blood flow. So red light was first studied by NASA, and it was developed to speed up the cell regeneration. So treatment with red LEDs reduces pain and speeds up the healing in humans. Cell regeneration was faster, showed an increase in blood flow, promoted new blood vessels to grow, decreased healing time. So there's over 2,000 research articles on neuropathy treatments. I'm not sure if this is for you. Just imagine for a moment that you're able to sleep through the night without pain. You're able to go on walks with your family, with your kids, your wife or husband. You're able to enjoy being outside. You're able to play with the grandkids. You're able to do all those things that you couldn't do before. So sleeping through the night peacefully, walking with confidence and feeling steady, driving again, taking trips, enjoying family outings, feeling like you're 10 years younger. Why do you want to feel better? So you got to have a reason why you want to feel better. Is it just to feel better, or is it to actually get out and do things? Because you want to make sure that you have a real reason to be feeling better. Because just being out of pain isn't usually strong enough for most people. So you want to actually have a goal, like being able to go for walks or play with kids or grandkids, those kind of things. So what do you do from here? Who should schedule an appointment with me? Well, if you have any of these symptoms, numbness, burning, cramping, electrical pain, prickling, tingling, balance problems, falling, can't sleep from foot pain. So what happens next? Your simple next steps: reserve your spot, get your consultation, and get your recommendations. So you want to bring the person that's closest to you to your meeting, because sometimes they're going to have a lot of insight as to what you're going through that you don't even know you have. So the normal pricing for this is $249. But because you're here today, we're going to make it just $77. So why wouldn't you do this? Who should not schedule an appointment? Well, this is not for someone who's not serious about getting healthy. At this point, feeling better is just not a must for you. You're just interested in the information, but not about doing anything with it. And you don't think your neuropathy is going to get worse. So why doesn't your doctor tell you about this? Well, your doctor doesn't tell you about this because they just don't know that it can be helped. They don't study this in school. They don't do this in their practice. What they do is they do drugs and surgery. If it's not a prescription drug that they can give you, then most doctors don't even know it's an option. So they do what they do, which is give you drugs or refer you out to someone else to give you drugs or for an amputation. So they're just basically covering up the symptoms. They don't know about any of these options. I mean, they don't talk to you about your diet for diabetes. They don't talk to you about getting healthy. They just give you medications for your blood sugar, medications to lose weight, medications for the pain. They don't do anything about getting you actually healthy. So this is another reason that the doctors don't talk about this, is because according to Medicare guidelines, this is directly out of Medicare guidelines, Medicare does not cover a treatment plan that seeks to prevent disease, promote health, and prolong and enhance the quality of life, or therapy that is performed to maintain or prevent deterioration of a chronic condition. Don't wait, neuropathy is progressive and it gets worse over time. So if you give us 30 minutes, we'll give you your life back. Remember, it's just $77 today because you're here. So just follow the link and then we'll get you scheduled for your initial consultation. All right, have a good day.